Welcome to today's video about symptoms of gallstones. What if 1 in 5 people around you, friends, co-workers, or loved ones, carries a silent health threat, a ticking time bomb they don't suspect? Gallstones afflict millions globally, often lurking undetected until they unleash excruciating pain or life-threatening complications. Each year, countless individuals are rushed to emergency rooms, blindsided by symptoms they dismissed as stress, poor diet, or aging. That nagging pain in your side, the subtle yellowing in your eyes, or the nausea that ruins your favorite meals could be your body's desperate cry for help. Warning of a condition that, if ignored, can spiral into infections, organ damage, or emergency surgery. Risk factors like obesity, rapid weight loss, diabetes, or a family history increase your odds, yet many remain unaware until crisis strikes. Today, I'm unveiling 15 scientifically proven symptoms grounded in cutting-edge medical research that could mean the difference between early treatment and a medical emergency. Symptom number 10 deceives thousands into believing they're suffering a heart attack, while the final one is so commonly misdiagnosed that even seasoned doctors miss it. This isn't just information. It's a lifeline to protect your health or someone you love. Stay until the end, as this knowledge could save a life by empowering you to act decisively and avoid devastating consequences. Please note, this video is for informational purposes only and not a substitute for medical advice. All research is verified. References are linked in the description. Now, here are the symptoms you need to watch for, starting with the first. Sudden upper right abdominal pain. Picture savoring a hearty dinner when, without warning, a crushing pain grips your upper right abdomen, so intense it doubles you over and steals your breath. StatPearls research explains this hallmark gallstone symptom arises when your gallbladder contracts against immovable stones, creating pressure that peaks 30 to 60 minutes after fatty meals like pizza or fried chicken. Patients describe it as more agonizing than childbirth, a vice-like torment radiating waves of agony that leave you gasping for air. The pain's sudden onset and vanishing between attacks create a false sense of security, delaying critical treatment. The American Journal of Gastroenterology confirms this isn't a stomachache. It's your gallbladder's SOS, signaling blockages that could lead to infections, ruptures, or pancreatitis. Even tiny stones in critical ducts trigger unbearable pain. A 42-year-old teacher ignored early episodes, thinking it was indigestion, only to face emergency surgery after a severe attack left them immobilized, unable to work or care for family. Prompt evaluation is vital to prevent life-altering complications, restore peace of mind, and avoid prolonged suffering that disrupts daily life and responsibilities. Next, number 2. Pain radiating to the right shoulder or back. Your gallbladder rebels deep within, yet your right shoulder blade screams as if stabbed. Berger's studies attribute this to the phrenic nerve, misrouting pain signals to distant areas, affecting 65% of gallstone sufferers. Few link this to meals, seeking relief through massages, heat packs, or painkillers, unaware of the true culprit. The pain worsens when lying down, explaining sleepless nights, pacing for relief. Neurological research shows gallbladder distress broadcasting pain through complex pathways, creating a dangerous disconnect. A 50-year-old accountant spent months treating muscle strain before a gallstone diagnosis, wasting time and money on ineffective therapies that offered no relief. Patients describe tossing and turning, desperate for comfort, only to learn their shoulder pain was a biliary warning. This misdiagnosis delays treatment, allowing stones to grow and complications to mount, risking severe outcomes. Recognizing this as a gallstone red flag is critical for timely intervention, preventing serious consequences and restoring restful nights free from pain. Next, number 3. Nausea and vomiting. A subtle queasiness after eating escalates into relentless nausea, untouched by antacids, ginger tea, or prescription drugs. BMC gastroenterology research highlights gallstone nausea's unique traits: persistent, worsening with movement, and accompanied by a bitter bile taste. This triggers food anxiety, turning meals into battlegrounds, leading to social isolation, weight loss, and nutritional deficiencies that weaken overall health. Neurological studies show bile duct blockages activate the brain's vomiting center, causing unstoppable waves. In acute attacks, violent vomiting offers no relief, as stones remain lodged. A 35-year-old nurse avoided dining out, fearing nausea mid-meal, missing family events, and feeling isolated from loved ones. Patients report anticipatory nausea, their bodies bracing for pain before meals end, a trauma response disrupting daily life and routines. This debilitating symptom demands urgent evaluation to restore digestion, prevent long-term health impacts, and reclaim social confidence and the joy of eating without fear. Next, number 4. Bloating and feeling of fullness. Your abdomen balloons after a few bites, transforming meals into uncomfortable ordeals, forcing you to loosen belts or skip social dining. Impaired bile flow from gallstones halts fat digestion, creating overwhelming fullness that defies logic. Researchers term this portion anxiety, as sufferers reduce intake, risking malnutrition, vitamin deficiencies, and unintended weight loss that saps energy. Ultrasound studies capture turbulent bile flow and trapped gas pockets, explaining the stretched, bloated feeling starting 20 to 30 minutes post-meal and lingering for hours. A 47-year-old chef missed family gatherings, unable to eat comfortably, feeling stuffed after small portions, which strained relationships and diminished life's joys. Patients cancel plans, lying down to ease pressure, frustrated by losing dining pleasure. Unlike normal fullness, this signals your digestive system struggling without bile, warranting medical investigation to prevent chronic digestive dysfunction, nutrient deficiencies, or social isolation that impacts mental health. Next, number 5. Belching or excess gas. Uncontrollable belching disrupts critical moments, business meetings, romantic dinners, or family gatherings, leaving you mortified and isolated. Gastroenterological research links gallstones to excessive gas from undigested food fermenting due to bile deficiency. Smart capsule studies show gallstone patients produce more gas, including hydrogen sulfide, causing foul odors that add insult to injury. This drives social withdrawal, as sufferers avoid public events to escape embarrassment. Over-the-counter remedies like simethicone fail, as they don't address bile flow issues. A 39-year-old manager declined promotions to avoid meetings, fearing outbursts that humiliated them in front of colleagues, stalling their career. Patients describe gas escaping at inopportune times, disrupting sleep, confidence, relationships, and professional life. Recognizing this as a gallstone symptom, not dietary indiscretion, is critical for seeking treatment, reclaiming social connections, and restoring opportunities lost to embarrassment. Next, number 6. Clay-colored stools. The shock of seeing pale, clay-colored stools in the toilet is a stark alarm that something's gravely wrong. Johns Hopkins research explains bile provides stools brown color via bilirubin. Gallstone blockages prevent this, causing dramatic changes overnight. Colorimetric analysis correlates shades with obstruction severity, aiding precise diagnosis. Stool color fluctuates, complicating detection, as patients dismiss early changes as dietary quirks. Even partial blockages cause subtle shifts. Early warnings most overlook until the condition worsens. A 44-year-old mother ignored pale stools. Facing emergency surgery after a severe attack crippled their routine and family responsibilities. Patients recall the panic, often the catalyst for seeking help, breaking months of denial. This symptom screams that your waste elimination system is compromised, risking liver strain or infection, urging immediate medical attention to prevent complications like cholangitis or liver damage that require urgent intervention. Next, number 7. Dark-colored urine. Your morning routine shatters when your urine resembles dark tea, cola, or coffee, triggering primal alarm. The National Institute of Diabetes and Digestive and Kidney Diseases shows blocked bilirubin filters through kidneys, causing this color change. Spectrophotometric analysis tracks darkening progression, reflecting obstruction severity, stone size, and duration. These changes precede other symptoms by 24 to 48 hours, offering an early intervention window. Dehydration can mask this, delaying recognition. A 52-year-old driver assumed dehydration, only to discover gallstones after persistent darkening disrupted their work schedule and daily life. Patients describe the panic of noticing this, prompting urgent doctor visits that saved them from worse outcomes. This visual cue breaks denial, urging evaluation to address gallstones before complications like liver damage or infection escalate, potentially requiring invasive interventions or prolonged recovery periods. Next, number 8. Jaundice. A subtle yellow tinge in your eyes spreads across your skin, impossible to hide or ignore. The British Medical Journal documents gallstone-induced jaundice starting in the sclera and becoming visible within days, causing profound anxiety and social embarrassment. Blue light photography detects it early, aiding timely intervention. Jaundice waxes and wanes as stones shift, creating false hope that delays treatment while liver damage accumulates. In darker skin tones, it appears greenish, often missed by providers, leading to misdiagnosis. A 41-year-old teacher avoided work, fearing colleagues' stares, feeling isolated and self-conscious, which strained professional relationships. Patients describe the emotional toll of others noticing their yellowing, forcing health confrontations. This visible symptom demands urgent evaluation to prevent serious liver or bile duct complications that could escalate rapidly, risking irreversible damage without swift action. Next, number 9. Fever with chills. Fever and bone-rattling chills alongside gallstone pain signal a medical emergency, transforming discomfort into mortal danger. Cleveland Clinic data confirms this indicates infections like cholangitis or cholecystitis, risking gallbladder rupture or peritonitis. Thermal imaging reveals heat signatures in the right quadrant before systemic fever, offering an intervention window. Low-grade fevers, 99 to 100 degrees Fahrenheit, in uncomplicated cases, are often dismissed, allowing infection to spread silently. This forms Charcot's triad, requiring immediate ER evaluation. A 46-year-old clerk ignored a low-grade fever, facing sepsis later, requiring weeks of recovery that disrupted family life and work. Patients recall shivering under blankets, their survival instincts kicking in, urging swift action. This symptom demands immediate attention to prevent life-threatening outcomes like organ failure, as delays turn manageable cases into emergencies necessitating aggressive treatment and hospitalization. Next, number 10. Chest pain mimicking a heart attack. Crushing chest pain at 2 a.m. sends you racing to the ER, convinced it's a heart attack, only to learn your gallbladder's the culprit. The Emergency Medicine Journal documents this masquerade, fooling physicians into ordering cardiac tests. Cardiac monitoring reveals rhythm disturbances from gallbladder inflammation, showing real heart effects via neural connections. The pain radiates below the nipple line and worsens with breathing, distinguishing it from cardiac issues. Women experience this more, possibly due to hormonal influences. A 55-year-old engineer underwent unnecessary cardiac tests, enduring stress and financial strain before diagnosis, fearing for their life. The trauma creates lasting health anxiety, with patients hypervigilant about chest sensations, fearing recurrence. Recognizing this gallstone symptom is crucial to avoid costly misdiagnoses, address the biliary root cause, and prevent recurrent distress or unnecessary medical interventions that burden patients. Next, number 11. Sweating profusely during attacks. Cold, clammy sweat drenches you during attacks, starting on the forehead and spreading, soaking clothes and sheets. BMC Gastroenterology notes this reflects autonomic distress, amplifying fear in an anxiety sweat loop. Biochemical analysis shows elevated stress hormones in sweat, indicating systemic stress. Biosensor research reveals sweating precedes pain peaks, an early warning ignored until attacks escalate. Anticipatory sweating to trigger foods shows your body bracing for agony. A 38-year-old designer recalled soaking through sheets, feeling like death was imminent, terrifying their family during a midnight episode. Patients described the overwhelming crisis sensation, unable to function, urging immediate medical attention to prevent full-blown episodes, address gallstones, and avoid complications like infection or duct obstruction, requiring surgical intervention to restore normalcy and peace. Next, number 12. Itchy skin. Maddening itching with no rash drives you to despair, starting on palms and soles before spreading everywhere. Liver disease journals link this to bile salts in the bloodstream, defying antihistamines and treatments. It peaks at night, destroying sleep and causing exhaustion that compounds other symptoms. Molecular studies identify itch receptors activated by bile acids, explaining treatment failures. This invisible suffering leads to isolation, depression, and mental health strain. A 43-year-old writer avoided social events, fearing uncontrollable scratching that left scars and strained friendships, impacting their creative work. Patients report scratching until skin bleeds, desperate for relief, disrupting daily life. Recognizing this as a gallstone symptom, not allergies, is critical for addressing biliary issues, restoring quality of life, and preventing long-term psychological and physical toll on well-being. Next, number 13. Food intolerances. Favorite foods, pizza, ice cream, or fried chicken, become enemies, triggering pain and misery. National Institute guidelines show gallstones create powerful food aversions, turning eating into a minefield requiring vigilance. Metabolic studies note physiological responses to fatty foods before consumption. Racing heart, stress hormones, and digestive preparation for pain. Intolerances extend to eggs, dairy, onions, chocolate, and vegetables, with pureed foods sometimes tolerated. A 49-year-old chef kept a food diary to navigate triggers, still facing attacks that disrupted their career and passion for cooking, diminishing life's joy. Patients describe the heartbreak of avoiding family recipes, reducing caloric intake, risking malnutrition. This culinary betrayal demands dietary overhaul and medical evaluation to manage gallstone progression, prevent digestive chaos, and avoid nutritional deficiencies impacting long-term health and vitality. Next, number 14. Palpitations or anxiety. After eating, post-meal racing, heart feels like panic, but stems from vagus nerve irritation by gallbladder distress. Digestive Diseases and Sciences reveals gallbladder cardiac connections, causing anxiety cycles that make eating dreadful. Heart rate variability studies show reduced vagal tone, explaining stress responses. Cardiac monitors confirm arrhythmias, not just perceived panic. Certain stone positions irritate the vagus nerve, sending patients to ERS repeatedly. A 40-year-old marketer feared heart disease until gallstone diagnosis, enduring months of worry that affected work performance and family life. Patients recall the terror of palpitations after meals, blurring physical and psychological symptoms, straining relationships. This highlights gallstones' systemic impact, necessitating accurate diagnosis to break the fear cycle, address the biliary issue, and restore calm and confidence in daily activities. Next, number 15. Chronic indigestion. Burning, churning discomfort. Mimics acid reflux, but signals gallbladder dysfunction, developing gradually until normal digestion is a memory. Mayo Clinic Proceedings. Note this creates exhausting food hypervigilance, with every meal requiring risk calculation and planning. Endoscopic studies show gallstones cause dysfunction from esophagus to colon, altering stomach emptying, enzyme production, and microbiome composition. It responds poorly to acid blockers, a diagnostic clue often overlooked. A 53-year-old mechanic endured years of discomfort, dismissed as sensitive stomach, finding relief only after gallbladder surgery, regretting the delay that impacted their quality of life and work. This constant noise drives sufferers to seek evaluation, making it a pivotal symptom for uncovering the hidden enemy within, restoring digestive health, and preventing long-term complications through targeted medical intervention. Next, medical tests to confirm your suspicions. To confirm gallstone suspicions, targeted tests provide clarity and guide treatment. Abdominal ultrasound, the gold standard, detects stones with 95% accuracy, safely and non-invasively in minutes, often covered by insurance. Endoscopic ultrasound catches tiny stones missed by standard scans, ideal for persistent symptoms despite negative results. HIDA scans assess gallbladder function, diagnosing issues like biliary dyskinesia without visible stones, revealing bile flow efficiency critical for planning. Blood panels, including liver function, amylase, lipase, and bilirubin fractionation, reveal dysfunction or infection. MRCP offers detailed bile duct imaging, catching hidden stones non-invasively. CT scans detect complications, inflammation, infection, or perforation risk, guiding urgent intervention. These accessible tests empower you to confirm gallstones, prevent delays, avoid emergencies, and ensure timely, tailored treatment to safeguard your health and peace of mind. These 15 symptoms aren't random aches. They're your body's sophisticated alarm system, screaming to prevent disaster. Ignoring them risks infections, liver damage, or emergency surgery. But modern medicine offers solutions, from dietary adjustments to minimally invasive laparoscopic procedures with rapid recovery. That test you've postponed out of fear or cost? Schedule it today. Your life may depend on it. Document symptoms meticulously, dates, triggers, severity, duration, to aid diagnosis. Don't wait for an emergency. Advocate fiercely with this knowledge. That pain, nausea, or yellowing isn't just stress. It's a call to action you can't ignore. Act now to reclaim your health and live confidently, free from this hidden enemy. If this opened your eyes to symptoms you've experienced, type yes in the comments. Which symptom shocked you most? Are you scheduling tests? Share your story. It could save someone from suffering or death. Subscribe and hit the bell for more life-saving insights. Your body's warnings are precious gifts, not annoyances. Listen closely, act decisively, and take control of your health today.